So, Dr. Bara, walk us through this. Then you're now in the hospital. You set up for us a scene about how many beds maximum could be there, and then the number of patients, and then you're also setting up a scene for us about how many Palestinians are living there. And you said about a group of 18 to 20 of you were in there. And in terms of the local Ghazawis, doctors, how many doctors and nurses are functioning from the hospital who are living there locally?
So from the hospital, there were about total of 20 doctors.
Okay.
For the entire 900 patients, which is nothing. Nurses, like real nurses, I think there were 1 or 2 nurses, real nurses, but there were so many. We would jokingly say pseudo nurses, which is a random person, could be a taxi driver, it could be an English teacher who developed to become a nurse, meaning there were so much lack of nurses there. So he or she, that person, will volunteer to learn how to become a nurse and will function as a nurse. So actual nurses, maybe 2 or 3 in the entire hospital. Pseudo nurses, if you want to call them, and this is not meant to disrespect them, but this is what would describe them the best. I would say 50 to 60 maybe.
So the queue system here, if you have, I'm sorry, go ahead. I didn't.
So no, but the hospital is meant to handle OBGYN cases, meaning the operating room or the so-called operating room is nothing more than a procedure room. If you compare it, not even to the US, even to any other field hospital in Syria, in Turkey, in Uganda, it's nothing more than a procedure room. And I think I sent you one of the pictures about me in one of those procedure room. You can see behind me there is only one cabinet. That's it. This is the anesthesiologist intubating one of the kids. And there's another picture where I'm operating, and literally you see behind me just a cabinet. That's it. Yep, exactly. So you see next to my right shoulder, that's it. That's all the instruments that exist in that so-called operating room, which is nothing, literally nothing. That's like a drop in the ocean of any other functional operating room, not in the US, but in the Middle East. I don't think it's fair to compare Gaza to the US. I'm comparing Gaza to similar countries within the Middle East, Syria, Turkey, Jordan. This is nothing. Anyway, so you do the surgery. So before that, I think one thing that people should know about, very often we will hear the bombardment. Very often we will even see the rocket coming at the house and destroying the house. And I remember 1 or 2 incidents where it was extremely traumatic. Not only we saw the rocket, but we could hear the people screaming under the rubble. Now, here is where it becomes disgusting. So imagine all of that is okay. Imagine for 1 second. We could hear them. We can hear them screaming. We saw the bombardment. We saw the missile hitting the house. It takes anything from 4 hours to 8 hours to get those patients to come to us, even though it's literally sometimes walking distance. Walking distance, it takes 4 hours to 8 hours to reach us, simply because anyone who tries to go help them will be killed right away. There is always a drone 24/7. They call it in the local Ghazawi language, they call it Zannana, because it's 24/7. So that Zannana, that drone, is literally going above us all the time. You see it all the time. And anytime there is a bombardment, anyone who tries to go help them right away, the Zannana, the drone, will get them right away. So usually until everything clears out, until the IDF forces back up, only then you can go and bring the wounded or whoever is still alive. So usually the delay time is anything from 4 hours to 8 hours, which was really traumatic because literally we can see the airstrike happening, we can hear it, but we couldn't do anything for them for another 4 to 8 hours. If you compare that to the US or anywhere here, like here when we have a trauma, usually as the ambulance is driving to the hospital, they call the hospital and tell them, we are 8 minutes away from you. There, it's 8 hours delay. I can't tell you how many times an ambulance guy will come to me and he will bring me 4 or 5 kids. And I think I sent you a picture with one of those. You have 4 kids. Yeah. If you can show it, I know it is disturbing, but I think we owe it to the people to show it to them. So if you can show the picture, if you could, if you feel it's appropriate. 4 kids, he brought them to us. And we put them in front of us. And as I'm examining them, yes, so those here. So unfortunately, so he gave them to us. And as I'm examining them, those two in the far, they were motionless. They were pulseless. They passed away. And the other one, so if you see that, so you see that kid here close up to us at 6 o'clock, and there is another picture where you see that kid and the kid next to him. Those two were alive. Now, the ambulance guy, and this is just one example, he swore to me, yes, this is the other one. So he brought those 4 kids in one trip. He brought them, he held like 2 at the time. He dropped them, he went back, he dropped the other 2. Those 2 were alive. Clearly, they have significant injuries. I don't want to go into too much gruesome details, but his head was blown out, but he was still alive. Those 2 were still alive. The other 2 were martyrs. The ambulance guy would swear to me that 4 hours ago, when he reached the area, all 4 of them were screaming. They were alive. But it took him 4 hours to reach us. So by the time they reach us, 2. Martyred. And the other 2 were alive, and I don't know what happened to them after that, because one of them had significant head injury. Literally, his brain was exposed, so I don't know what happened to him afterward. But the point is, at the time of the injury, at the time of the ambulance arrival, all 4 were alive. Just by the virtue of waiting 4 hours, 2 passed away.
So tell us, Dr. Bara, these children come in or other patients come in. What tools do you have? What do you have? Pain-numbing medicines. What do you have to work with there in these hospitals?
Very, very little. And remind me maybe later to tell you the story about the ketamine. The ketamine has a very special story that happened there, but very little. And unfortunately, because of the limited resources, most of the surgeries I've done were amputations. And just to give you perspective, just again, this is the public health speaking inside me. I was keeping a record, a log of all the cases that I was doing there, just for my own education, to see what cases I'm doing, what cases I'm not doing, and whatnot. By day 4, I looked at my log and I broke into tears, because I realized that in 4 days in Deir al-Balah, I've done more amputations, mostly on kids in 4 days, than I have done here in the US in 2 years. So in 4 days, I've done more amputation than what I've done here in 2 days, in 2 years in the US. And I'm a vascular surgeon, so that's my specialty. I am responsible for amputating the leg when there's a vascular disease and whatnot. So that's what I do for a living. But still, in 4 days, I've done more than what I've done here in 2 years. One story that stood up to me, and again, this is what I told you as a public health. I wouldn't go into that story, but I think I owe it to the people to hear those stories, to tell the misery, to tell what's going on in Gaza. A kid came to me, and there was a bombardment. At the time he came, and his right arm was completely gone. It was already amputated. We don't even have the remaining pieces of his body, but it was already amputated at the elbow. The left arm, the 4th and 5th finger were already gone. The 3rd finger was hanging by a thread. Now, that baby, from my estimation, he was 9 to 12 months. We don't know why, and I'm going to tell you why in a minute. But from my estimation, 9 to 12 months from the appearance of his diaper and from his growth, I think he's 10 months old. So I'm thinking about, what do I do with this kid? His right arm is completely gone. His left arm, he has 2 fingers, and the 3rd one is hanging by a thread. So I spent about 2 hours suturing and attaching all the tendons, all the vessels of the 3rd finger. And my hope was, if I can give him a functional 3rd finger, at least he can feed himself. So at least he can do this and feed himself independently. So I spent 2 hours doing my best work I can ever do to attach the 3rd finger. And I think I did it, but I'm very, for the lack of better word, I'm very proud of myself. I'm happy. I cannot wait to tell his parents that, listen, I'm sorry about the bad news. We lost one hand, but guess what? I managed to save this finger. So alhamdulillah, there is hope for your son. So please don't despair. So I cannot wait to tell the parent. So I'm removing my gown. I'm telling the staff, show me where's his parents so I can update them. And they looked at me and they said, no one told you? And they said, told me what? They said, I thought we told you, but his whole family is wiped out. His parents, his 4 siblings, he's number 5. He's the youngest of 5. They were all dead. And even his uncle and his uncle wife and whatnot, they were in the same house. They were all gone. There was no surviving family member for this kid. And honestly, and again, that's where I think the numbers, that's where I object to using the numbers in Gaza. When we say 20 people died today in Gaza, like today, the news in Rafah, 20 people, one here, 500 injured and whatnot. On what basis those numbers are going to describe to you the misery of this one kid that I'm telling you his story? Like what magnitude can explain the misery of this kid who's barely 10 months old, according to my estimation, growing up? He has no hand. He has 2.5 fingers. He lost everyone. What can explain to the world? What can explain to our wonderful politicians here in the US? What can explain to anyone who's still supporting the Israeli advances in Gaza? What can explain the misery of this little kid? And this is where I told you I'm gonna break my own rule about staying away from emotional and personal story, because I really think nothing can explain the numbers better than a story like this.